Good morning. This is Danielle Peach, and I'm here with Dr. Linda Ritchie, and it's my pleasure to announce her. She's the director for the Center of Life Strategies, and she's in private practice in Reston, Virginia. She specializes in cognitive behavioral therapy and marriage and relationship counseling, and clinical hypnosis. So a little bit about her background. She's been a military officer for 23 years, way before she started her clinical therapy. And that she was serving both in the U.S. and outside the U.S. And she is also a licensed practitioner of neuro-linguistic programming and a certified consultant in clinical hypnosis for the American Society of Clinical Hypnosis. So today, what we're going to talk about is something that we can all use help with. Specifically, we're going to talk about self-care, how you can deal with stress, how you can deal with anxiety during the time where we're all shut up at home. We're stuck with this coronavirus. We're stuck with the protests. We have a lot going on in our lives, and yet very little going on in our lives in some other ways. So I know that many of us are affected. Both those listening, those talking, we're in the same boat. We're all in the same boat here. So let's talk about some techniques that we can use to rewire our brains.
Yes,
and
absolutely.
calm our nervous system.
Okay. All right. Well, let's talk. Maybe a good place to start is why do people get anxious in the first place, and what's happening in your body when you get anxious? And what is happening is that there's this tiny little part of your brain that goes into overdrive. It's the amygdala. And that amygdala gets activated and you get anxious. And typically what is happening, what causes that, are your thoughts. So you're either worrying about something, thinking about something that happened in the past that was disturbing, and it's as if you are there again, and your body is responding as if it's happening in the moment. Or you're worrying about something that's happening in the future or might happen in the future. And again, your body responds as if that's actually happening.
So how can we control our thoughts?
That's a very good question. And that is the crux of my practice, is helping people control their thoughts so that their thoughts don't control them. The first step is you've got to be aware of your thoughts. Pay attention. So much of what goes on in the brain is sort of in the background. What I compare it to is your brain. Our technology is amazing. Our technology, our smartphones mimic our brains. So imagine on your smartphone that you've got the screen on, and that's what you see. That's what's right in front of you. However, running in the background are all these open windows, right? So that every now and then you've got to punch that button and you've got to close everything out. Otherwise, your phone goes into overload and your battery's dead. Well, that's what happens to your brain. You've got all these open windows that you're not really aware are open, but they're taking up energy. They're active.
Do we know what makes us anxious? Because a lot of times we're anxious and we don't even know why.
Sometimes yes, sometimes no. And that's where really tuning in to your feelings are important. Feelings are I compare feelings to the lights on the dashboard of your car. They are indicators. So the goal is not to push it away. The goal is pay attention to it. It is an indicator. Just like if you have a light come on the dashboard of your car, you don't want to put a sticky over it, so that it goes away. It's an indicator. It's not a good light or a bad light. It's just a light that is an indicator. The question is, what does it mean? What is it that you need to take a look at? Your feelings are the same way. So when you feel anxious, pay attention. What's going on? What are you thinking? Are you worried about something? Are you worried about something that might happen? Are you thinking about what your husband or your wife said or your kids said yesterday and what you should have said and what you want to say and what you're going to do, in the future
Right.
when this happens. So your mind just goes into overload. It's kind of like you've got this conference room going on in your head, and your body responds to that.
So how do we calm these thoughts? How do we distinguish what thoughts to close, which thoughts not to close?
Well, again, the first step is pay attention. What is it that you're thinking? And most people don't do that. You just think, oh, I'm just feeling like this. But when you stop and just take a moment and say, what am I thinking? Where is my mind? If you are awake, your mind is working all the time. You've got about 65,000 thoughts a day. When you start paying attention to how much of those thoughts are negative, how much is worry, your self-talk, that's your inner dialogue. Most people don't pay attention to that. Again, that is the number one reason I get clients coming in to see me, is because of anxiety, especially recently, because there's a lot to think about, right? A lot going on in our world.
Absolutely true. That's a very good point. So what are some practical tips that we can do that will help us deal with this anxiety?
Recognize your thoughts. Ask yourself, is it true? Is what I'm thinking true?
Because sometimes they're delusional thoughts, right?
Right. They're distortions. They're distortions. They're
You've
not
told yourself
reality.
this is something, but the reality isn't that.
Right. The reality isn't that. So if you have distortions in your thoughts, then they're not realistic. And the goal is not to change your thought from a negative thought to a very optimistic thought, because that might not be optimistic. That might not be realistic.
So we shouldn't be Pollyannas?
You don't need to be a Pollyanna. The goal is to be realistic. And if you get rid of the distortions, it moves you along that continuum of being more realistic. The world is not ending. The world is not chaos. Yes, there are some things that are going on that aren't great, but that's far different than thinking that, it's a disaster. So the words that you choose, is it true? Is it a distortion? And you don't have to change it to something that is everything is wonderful and everything's going to be great. Maybe not, maybe not wonderful, maybe great, but we'll get through it. We'll figure out and we'll make progress. So it's really just paying attention, challenging your own thoughts, recognizing, are there distortions? Are you falling into everything is black and white, all and nothing? Are you discounting the positives? Are you focusing on the negatives? Are you personalizing it? It's my fault or it's their fault. So these are some of the common distortions that are they're common distortions. You're not going to find anybody anywhere who doesn't have some distortions in their thinking some of the time. That's just reality. The question is, to what degree does your thinking fall into that? Because that's going to determine how you're feeling. And the first thing is to challenge your thinking. Is it true?
How do you know it's true or not? If in your perception, it appears to be true, like the world is persecuting you, how do you get out of that mode of thinking that that's what's happening, or so and so is picking on me? How do you determine whether it's a distortion or that your feelings are accurate or not?
Well, it's kind of an evaluation process of, somebody's picking on me. That might be true or not. I don't know. That would be a case-by-case basis, right? But you've got to be able to kind of recognize your own thoughts and challenge them. And that's going to be different, for every situation. There might be some reality in your thoughts. Not everything is negative or unrealistic. Bad things happen sometimes. Bad things happen to good people. And so it's not great if that the coronavirus is happening. This is not a good thing. I don't think anybody would say that. But it's also not the end of the world. So you've got two opposite ends.
So what about people who say, I am so afraid of this coronavirus, I cannot leave my house? what would you do?
Would look at what is the fear? Is the fear realistic? Nobody wants to get the coronavirus. There are people that are at higher risk. We have been told by the authorities that need to take more precautions than other people. But even looking at you can't leave your house. Is that true? What about your backyard? What about walking around the block? What can you do that where you can also remain safe? Because the real goal is not staying in your house. The real goal is being safe. So looking at, is that true that you can't leave your house? Maybe not. Maybe you can leave your house. Maybe you're not going to, go to church with 400 people. Maybe you want to have somebody else do your shopping if you are at high risk. But can you leave your house? You might be able to find ways to leave your house. So again, that's kind of all or nothing thinking. Can't leave my house.
So avoiding this all or nothing thinking.
Avoiding the all or nothing thinking.
So what can I do what can we all do if we're feeling like, I can't go out with my friends, I can't do this, I can't do that, the negative thinking syndrome.
Right.
What can you do to get yourself out of the negative syndrome?
Look for what you can do, as opposed to identifying what you can't do. What can you do? Life changes for all of us. As we get older, we can't do things when we're older that we could do when we were 20 years old. But we can still do a lot of things. You and I know that.
Yes, right? Indeed we do.
So what can you do? If you can't go to a concert, if you can't go to the movie, you can't go to the gym, which was a situation I faced. I loved going to the gym. Well, I can't, but I can work out at home. I can do some things. I can put in a video and work out. I can work out in my garage. I can go for a walk. What can you do? So you start focusing on what you can do as opposed to focusing on what you can't do.
And can sometimes those negative thoughts be so pervasive that they actually fall into your nightmares or your dreams and you can't sleep?
Absolutely. They can. Yes. And if that's happening and it's interfering with your sleep, because especially during this time, you want to focus on making sure that your basic self-care, sleeping enough, eating well, nutrition, getting some exercise, taking care of yourself, taking time for yourself, being on a routine to where you're not staying up all night and sleeping all day. Just your basic care. That's probably the first thing that you want to do in order to feel good about yourself and feel good about life in general.
Mm-hmm. So, what are some practical tips that you give your clients in the behavioral cognitive therapy to teach them how to deal with these thoughts?
The first thing is to challenge the thought and to recognize that just because you have a thought doesn't mean it's true. And if you have a thought often enough, it's going to become a belief. Your beliefs are nothing more than thoughts that you've had over and over and over to the point where you don't challenge them anymore. So if a thought can not be true, then a belief cannot be true.
So that's sort of the eyes of the beholder. So for what one person might create huge stress, the other person isn't even affected.
Absolutely. Yes. Different things stress people differently. So, and stress is caused by the context that you give it. In and of itself, one of the things that I tell my clients very frequently when they feel anxious is be in the moment. In this moment, everything is okay. In this moment, right now, I'm okay. And that's usually the case, unless you're in the middle of a hurricane or a flood or something that's actually going on. That's not usually the case. That's not what causes people to be anxious. People that are in the middle of a crisis, yes, their amygdala kicks in, but that's good anxiety. That's fight or flight. That's what do I need to do to protect myself? But when you're anxious, just sitting in your living room, or you're going to bed and you're waking up anxious, that's your mind going into overload when it needs to be turned off, and recognizing that right now I'm in bed and everything is okay. And worrying about what's going to happen tomorrow, worrying about the possibility that what if I get sick? Well,
that's not today.
That's not today. That's not happening right now. It's not to say you don't take precautions and you be smart and you protect yourself, but it's not happening. And it's not doing anything to prepare you for if it does happen. Worrying about something is a waste of your imagination.
That's a great thing to remember. Worrying about something is a waste of your imagination, because we all have imagination.
We all do. Yes, thank goodness.
And sometimes some of us have imaginations that are way more active than others.
That's right. Yes.
So that's a very good thought to remember.
If you're going to imagine something, imagine the best outcome. Imagine how you would like it to be. Imagine yourself feeling the way you would like to feel. Imagine waking up feeling good. Imagine walking out the door in the morning and being able to go for a walk around the block or in your neighborhood. All right, you can't do some things that you could in the past. You can't go to the gym. You can't interact individually with people. But
for me, it's you can't go to the theater. You can't
go to the theater. We can't do some of these things.
You can't go to meetings. You can't meet with friends. You can't meet with family. What do you have any practical things that you tell clients to if they just feel these feelings are overwhelming them, and maybe they're at work and they can't just go for a walk?
Yes. I've got a couple of things that are my go-to for anxiety, because literally, again, anxiety it's caused by your thoughts, but your body is reacting. So you've got this physical response, and you want to calm the physiology first. So, okay, in this moment, I'm anxious. I'll work on my thoughts, I'll get to that. But in this moment, I just want to bring myself back to the moment, and I want to feel calmer so that I can evaluate. Because if you're really anxious, it's difficult in that moment to say, are my thoughts true? You're just in too heightened of a state to be able to do that in that moment. So one of the things that is so simple to do is take an object. I've got a bottle, a drink right here, and take that object and simply pass it back and forth for as little as 90 seconds. Simple, right? Just take it, and it could be your phone, it could be a pair of glasses, doesn't matter, just something. Let the arms swing out to the side as you pass it back and forth. Cross that center line of the body. What this is doing is activating different parts of your brain. It's a bilateral stimulation. It activates your parasympathetic nervous system. It's a calm down button. That's very easy.
Great tip.
It's very, very easy. As little as 90 seconds is going to do that. The second thing that is, I tell anybody with anxiety, is diaphragmatic breathing. Now, if you're a singer or you're a musician and you play a horn or a wind instrument, you know what diaphragmatic breathing is. If you've done yoga, a lot of people who are practicing yoga have worked on their breathing. It's breathing. As adults, we tend to breathe from our chest, very shallow from the upper part of our lungs. But if you breathe from the lower, if you engage your diaphragm, which is like, imagine you have a balloon down in your stomach, and you're going to blow that out so that you're getting movement down here as opposed to up here. That is not a deep breath. That is actually tensing your shoulders and coming up. You want to engage your diaphragm and just take some nice, slow, long breaths. Think of it as taking 4 counts to breathe in. Hold it for a moment. And then just exhale. If you take about 8 breaths, that's about 2 minutes for the average person. 2 minutes worth of breathing will literally reset your physiology. everybody's got 2 minutes. Everybody, I don't care how busy you are, you can find 2 minutes to just stop, close your eyes, which is helpful because it'll block out all the other stimulation, and just bring your mind back to your breathing and take 8 slow breaths. And that is going to literally reset your physiology. And then you can decide, okay, now what? Now what do I do? So those two things.
So you're focusing on something else that is then relieving.
Is right. It is a
stress.
Pattern interruption, right? This is all your brain. This is your brain functioning.
Mm-hmm.
So it's, again, I'm going to compare it to a smartphone. Have you ever had to turn your computer off because you had too much going on and you just had to reboot it? Well, hello, again, technology imitates the way that we work, the way our brain works. So just like sometimes you've got to reboot your computer, you need to reboot your body, reboot your brain.
You mentioned that we have like 86,000.
Yeah, 65,000 thoughts.
65,000.
Yeah, roughly. Yeah.
That's a lot of thoughts.
That's a lot of thoughts. And you're not aware of most of that. You're not aware of most of it. Again, all those windows opening, taking up space. But when you stop and breathe, you're just focusing on your breathing. Just think of your breathing. And exhale stress, inhale calm. And you do that for 90 seconds, 2 minutes, you're going to then feel better. Then you can say, all right, now what?
And these are things that you could do at work. You could do this in the middle of your day. What about things like if you're at home, just listening to music or reading a good book or things like that? Do those help?
Pleasurable, absolutely. So many people feel stressed when they're overworked, right? They're overloaded because there's too much of something.
Or they are not doing their work because they're stressed and they're therefore blocking their ability to do the work, right?
Correct. Because they're imagining what might happen if they get sick, or if this person is elected, or if this person isn't elected, or whatever the case may be. So there's a lot of things that can get in the way. But the reality is there's a lot you can do about it. You're not helpless. If you suffer from anxiety, and we all do at some time or another, we all feel anxious, but there are so many things that you can learn to do to take control of the anxiety. Anxiety is the number one issue that people come in, my clients come in, it's the number one presenting issue. If you talk to any mental health care, psychiatrist, psychologist, social workers, anxiety, that's the number one thing. And again, it's all your own brain that is creating that. But you do have control of your thoughts. You can learn to take control. You can learn how to use that smartphone, It's like there's some instruction. There's not an instruction manual for your brain per se, but there are a lot of proven techniques that are just really helpful, that help you dial down the anxiety, help you eliminate the anxiety. And once you know how to do that, you feel more in control. Anxiety is also, it's a feeling of being out of control, a feeling of not having a say-so. But you can learn some things to be able to combat that.
So let's get to some of the questions. But just before we do,
sure.
Is there situations where, you may be trying all these things and none of these things work, where you need to hype it up and actually go see a doctor and take medications?
Sure, there are. I certainly am not anti-medication. I work with a lot of anxiety. I would say the vast majority of people that I work with for anxiety, which is a lot, especially over the years, the approach is the therapy, which is really just coaching for it. You don't know how to do this, so people come to see me because they don't know how to control that anxiety. All I'm doing is giving you techniques and strategies for here's how you do it. I'm not doing it for you. You are doing the work, but it is within you to do that. You have the capability. You just don't know how, So
what about if you Does the hypnosis factor help?
Hypnosis is also a technique that I use.
No, we're not talking about Manchurian candidate type hypnosis here.
No, hypnosis is just another way of being. All hypnosis is self-hypnosis again. When you are in hypnosis, you are in control. I teach people how to do self-hypnosis. It's another way of calming your brain, of slowing your brain down. So it's just another technique. And doing self-hypnosis is something that you can learn to do. There's several different ways to do it, very easy, but it's just another way of calming the physiology, slowing the brain down, focusing the thoughts. You're always going to be thinking, but focusing them on what you want to think rather than what is just coming up automatically. You do not have to be a slave to the automatic thinking. We all develop automatic thoughts. A lot of them are negative, but you can learn to control them. But back to your question, Danielle, because you ask about, medication. Are there people? Yes, there is. The research shows that there is a lot of evidence that would indicate that some people are just hardwired to be more anxious than other people. So there's evidence that there's a genetic factor in that genetics do play a role in anxiety. Doesn't mean that even though you might have a propensity to be more anxious than somebody else, still doesn't mean that you can't take control over it. Just like everybody, we're all genetically different. We have different talents, different strengths, different weaknesses. But if therapy isn't working, if you have learned techniques to work with the anxiety and it's just not getting you to where you are comfortable in day-to-day activities, it would then is the time that you would want to seek medical advice and get an evaluation for, is medication necessary? For most people with anxiety, you can learn techniques to handle it without the medication. For some, no, the medication is very helpful. For some, it's absolutely necessary. And you really need a professional opinion.
And that's if someone who is at risk of being suicidal, I assume, or something like that.
Absolutely. If it is really interfering in your day-to-day function, get help.
Yeah.
Get help.
So we're going to post also Linda's contacts. Dr. Ritchie is available if you wish to contact her, and we'll post that. So let's get to some of your questions. How do you tame your thoughts? Is there a special technique to tame your thoughts? Can you tame your thoughts?
Tame your thoughts. Again, taming your thoughts would be identifying what is the specific thought. You need to think about what you're thinking in a specific situation. What is so common is people will think about anxious and they're like, well, I just woke up anxious. Okay, all right. What were you thinking about when you woke up? What was on your mind? People want to overgeneralize. Generally, this happens.
And people don't want to take control.
They don't want to take control.
They just want to let the thoughts control them.
They let the thoughts control them. So you have to look at, in order to tame your thoughts, look at a specific moment in time when you were feeling anxious. It might be right this minute. It might be, okay, at 10 o'clock this morning, I was feeling really anxious. What was going on? What were you thinking? So you have to evaluate it, and you have to be specific in the time, because what you were thinking at 10 o'clock this morning isn't going to be what you were thinking at 2 o'clock yesterday. Even though you were feeling anxious at both of those times, you were having different thoughts. So you've got to chunk it down, break it down into bite-sized pieces. You can't just say, I'm anxious, what do I do overall? Well, when were you anxious? Give me a specific moment in time. What was happening? What were you thinking in that moment in time?
So you're having like a dialogue with yourself, which is very difficult to do unless you're actually sort of being channeled by someone like yourself, because sometimes you may be like, well, but I have all these thoughts. I can't really distinguish which one is the problem. So here we have another question. Are there things you can do to yourself to help calm your nerves or thoughts? And I think you talked about the diaphragmatic.
The diaphragmatic breathing is one that probably the number one thing that you can do, because if you are refocusing your mind on your breathing, it's a pattern interruption. You're stopping that process. And then it puts you in a better position to slow it down and evaluate,
And the technique that you explain.
And the bilateral stimulation of passing something back and forth is another technique. Learning how to challenge your own thoughts, in my opinion, and I'm 100% biased in my opinion on this, is that learning how to evaluate your thoughts and taking control of your thoughts is a life skill that is invaluable for everybody.
If we could only do it now. Is it a matter of exercising patience with oneself, believing that down the line things will be okay? You did talk about positive
thinking. Yeah, your inner dialogue, what you're saying to yourself, is very important. I will say, and I have no financial ties to this, but I'll give a plug for a book that I recommend to my clients all the time. It's called What to Say When You Talk to Yourself by Shad Helmstetter. And it's written decades ago, but it is true now, it will be true decades from now. Your self-talk, how you think, what you say to yourself, has a tremendous influence over how you are feeling. So pay attention to, what are you saying to yourself? Most people are harder on themselves than they are on other people. And stop and think about it, because I've never had anybody say no to this. I've never had a client come in. I've never had a friend that said, oh no, I only think wonderful things about myself. You do something.
This you're megalomaniac.
This is
we know maybe a couple people like that.
Maybe. But most people will beat up on themselves and say things to themselves. They'll call themselves names. They'll say, I'm such an idiot, or I'm so clumsy. You do that over and over again. You wouldn't say that to your friend. If your friend knocks over a water bottle, you wouldn't look at her and go, you're such a klutz, you're so clumsy. And yet you do that, and that you say that to yourself. Well, it has the same effect on you as it does if you said it to your friend. So stop it.
Stop talking bad things to yourself.
Be kind to yourself. Treat yourself like a friend.
That's excellent advice.
No, treat yourself like a friend.
So COVID has definitely made it more difficult to stay calm or anxious-free. What are some coping mechanisms that people can use to avoid letting their minds wander too far into negative spaces? And you did talk about a couple of techniques on that, so I think we've answered that question. Next question, how do you support a loved one who is affected by the COVID and needs an unwavering support, but you are so worried for them and having all these fears and concerns for their well-being? But you get that one a lot.
Worry and fear. What is that based on? If you're worried about something, is it a reality? Is it happening? Or are you, again, imagining what might happen? Because typically worry and fear are based in the future. It's not something that's happening now. You want to make sure, if you have a loved one that is at risk, or even experiencing, even is sick, maybe they have the virus, are they being taken care of? Are they getting the support? But worrying about the worst case scenario and what might happen is not going to be helpful in any way, either to you. It's not going to be support for them either. So staying in the moment, staying in reality as opposed to imagination. If you're going to imagine something, imagine the best outcome. Imagine that they're sick. Okay. They're going to get through that. They're going to get well. Imagine that as opposed to the worst case scenario. Again, it's all in your head. It's kind of like you're making this movie in your head. Well, you write the script. You're the director. How would you like it to end?
So that sounds almost a little bit like people who have faith, that believe that these miracles happen, that if you have faith in yourself.
Yes.
It almost sounds like that. We have another question here. How much does the environment influence your thoughts?
The environment can influence your thoughts quite a bit. Particularly, and I'll just hit on one point of the environment, the people that you're around, the people that you associate with. If you are in an environment where you're surrounded by people that have a lot of negative thinking and are always fault finding and are always criticizing, and then that's going to have an effect on you. Can you do something about that? Sometimes, if you can, do something about it. Put yourself in a different environment. If you can't do something about it, look at what can you do to protect yourself to where you don't fall into that same pattern of being critical, of being judgmental, of being blaming, because those things are not going to make you feel good.
That's very sage advice. So COVID has definitely made it more difficult to stay calm or anxious free. What are some coping mechanisms that people can use to avoid getting their minds to wander too far into negative spaces? And I think we've talked about that.
Again, it's about focus. It's about recognizing that, you're going to automatically, okay, here's the coping advice. Turn off the news. You don't need to be glued,
because you do get very negative thoughts when you're constantly watching deaths, constantly watching, and most news, let's face it, is negative. Very little of it's positive.
Right. You be informed. You need to. Yes, you need to be informed about what's going on. It is prudent to know what precautions you need to take. You need to know what are the rules. What are the authorities saying to do or don't do? What can you do? You need to know that, but you don't need that drilled into you 24/7. You don't need to see over and over and over again the negative things, the hurt. And there are a lot of negative things that do happen, but the news is full of that. There are also a lot of positive things. There are people who are treating other people wonderfully. There are people who are helping other people. Choose where you direct your attention. That is within your capability. You have a choice. You don't have to focus on what some director at some news station thinks you need to be focused on.
So just to summarize, what are the 2 or 3 things that you think are the most important in our discussion today for anxiety?
Be aware of your thoughts. Recognize that anxiety is caused by the way that you are thinking. Everybody has the capability to do this. It's a matter of slowing down and just saying, what am I thinking? What is my thought? How am I feeling? Recognizing the anxiety. It's an indicator. You don't want to push it down. You want to dial it down. But the way to do that is to recognize, what am I thinking? Am I living in the past, something that happened that was upsetting? Am I worried about what's going to happen tomorrow, next month, next year that I have no control over? Think of a stop sign. Stop. Just stop the thought and direct your thoughts to something where you want your thoughts to go. Use your breath, the diaphragmatic breathing. Reset your physiology. The bilateral stimulation that I showed a little bit earlier, another quick and easy way to reset the physiology. You have to pay attention. Anxiety is real. If you're feeling it, you're feeling it. That's valid. It's an indicator. Pay attention.
Thank you so much.
You're very welcome.
It's been very enlightening and very helpful, and hopefully we'll be able to use these tips. Just wanted to tell you about next week, Friday at 10. We hope to be talking, and in fact, we will be talking about VAWA, Violence Against Women's Act. We'll be talking about that in the context of how it's a relief for immigration in how people get green cards based on this relief, and what things you need to do and to prepare for it, and what documentation you need to be able to win. Because this is also a sort of an isolating fact, because it's dealing with someone who is actually abused, whether it's a male or female, by their spouse or their parent or somebody else. In the context of immigration, usually it's the spouse. So tune into that. If you liked this video and you thought that you had good tips, please tell us what you liked about it. Give us a thumbs up. And we appreciate you tuning in. Share it with people that you feel could benefit from it. That's always a good thing. Thank you again for being in today, and we will see you next week. Thank you. Bye-bye. There we go. How do I go there?